Dr. Bryn. I'm sitting here with Dr. Zach today and Office Manager Ruby, and we're talking about kids in chiropractic care. So a couple questions that we get from parents are, why should kids get chiropractic care? What kids are susceptible for low back pain, and how effective or safe is it? So Dr. Zach went ahead and he wrote up a blog, and that's now posted on wurthchiro.com. So go check that out. It's really good. And he's also going to talk about a little bit of those questions. So go ahead.
Thanks, Dr. Bryn. So the big question we want to answer today is why should kids get adjusted, or if they should get adjusted at all? And to do that, we're going to answer two other questions first that Dr. Bryn mentioned, which is what kids are susceptible for low back pain, and how effective and safe is chiropractic care in treating some of those conditions. So the first question we're going to tackle is what kids are susceptible for low back pain. So we looked at an article from the Journal of Chiropractic and Manual Therapies that took a look at some possible risk factors for low back pain, and we compiled a little bit of a list of some of those, which are as follows. The female gender itself is more susceptible than males for low back pain. The older you are in adolescence, more susceptible. After puberty, post-puberty, oftentimes you see kids experience low back pain, as well as a positive family history for low back pain. So those kind of are some different risk factors that might be indicative of or relate to your child having low back pain. The next question that we kind of took a look at is how effective and safe is chiropractic care for kids? While chiropractic care is incredibly safe, some of the research isn't incredibly conclusive on chiropractic treatment for kids. There's just not a ton of research out there right now. We're hoping that over time and over the years, there's more revenue put into that, more funding put into that, so that we're able to take a closer look at chiropractic care for kids. As evidence-based practitioners, there are three kind of legs to that stool, and one of them is clinical experience. Clinical experience is a huge thing, is a huge aspect for chiropractic care for kids, because many practitioners can go on and on about many case studies or individual cases where they saw excellent results with kids, whether you've heard bedwetting or being relieved with chiropractic care, or colic or ear infections. There's a variety of different childhood conditions that have shown really good results with chiropractic care. The high quality research just isn't quite there to back it up yet. But we're going to talk a little bit about some of our experiences in clinic with kids and how it's kind of shaped our clinic. So when we were in Palmer College in Davenport, we had the opportunity to work with a bunch of different kids with our staff doctor, Dr. Clark. So I had the chance to work with a 1-year-old who was diagnosed with plagiocephaly, which is just kind of a flattening of the skull. And what we did is we did some soft tissue adjustments, or some soft tissue work and adjustments. And over about a 2-month span, there was less flattening of the skull. So whether that was due to the chiropractic care and the soft tissue, or it was something that was just going to self-resolve anyways, either way, the results are great. And that's just a great example of many different childhood cases that can kind of resolve, maybe not with tons of evidence backing it, but we see great results in the clinic. Do you have any good stories like that, Dr. Bryn?
So my stories is more so on how we want our atmosphere to be in our clinic. And I had 2 families specifically that I remember that had 2+ kids that would come in every time. And it was awesome. It was always such a fun atmosphere. It would always be a good time. They would come in, they would feed off each other. I would learn a lot about things. They would learn a lot about things. We would adjust, get it all done, and it was great. It was a great way to break up my day too. It was great. It was so much fun. And we hope that's how our atmosphere in our clinic is too. We want you to bring everyone in at once. If you can't, that's fine, obviously. But we want you to bring everyone in at once. We want to create that wholesome home atmosphere. Also to note that some of my families, they wanted activator instead of manual, and that's totally fine. We can do that. That's a little bit of a lower force. They just like it better sometimes. So again, that's another thing that's shaping our atmosphere, is we can do whatever you want as a patient and whatever your kids want as our patients as well. It's something that's, again, we want you to be comfortable. And that's kind of where I've shaped my world in, I guess, to say.
Yeah, that was a great point of mentioning some of the modifications that we make. We're not going to be thrusting or adjusting as hard or with much force as we are with an adult. Children have smaller spines and require less force. There are, whether it's an activator or it's just kind of a sustained pressure that we use, there's tons of modifications that we can use for kids to make them comfortable, to make the parents comfortable. That's the most important things, that all parties are feeling comfortable in our office. So getting kind of back to this overall question is, why should kids get adjusted? overall kind of picture here is that kids are just like you and I. They're growing, they have spines, they are susceptible to injury, they play, they jump, they do all sorts of things throughout the day that can cause dysfunction in their joints. And as chiropractors, we're really well trained in taking care of those joint dysfunctions and allowing their spine to move more properly. So we thank you guys for taking part in this video today. We love this topic. We love taking care of kids. If you have any questions, please feel free to reach out. You can reach us through email or give us a call. We are also looking forward to our office opening officially sometime in May, and hopefully going to do some of these videos in there. But thank you guys so much for following along today and ask any questions you have. Thanks.
Thank you.